Hello, my name is Lakeisha Gilden, and my topic today is heart attacks in women. I chose this topic to bring awareness to heart disease in women. Will be presenting to you information about the different symptoms that men and women face, the misdiagnosis of heart attacks in women, and the obstacles that women of color face. Many of us lack the knowledge to identify the signs and symptoms and the risk of heart attack in women, especially women of color. The Centers for Disease Control and Prevention mentions in their report that women, that heart disease is the number one cause of death in women of any age, especially if they have high blood pressure. I'm going to speak to you about the heart attack symptoms in men and in women, which leads to the underdiagnosis of heart attacks in women, and the obstacles that women of color face using reports from the Center of Disease Control and Prevention, the American Heart Association, the National Heart, Lung, and Blood Institute, and an article by Dr. Siddiqui, who is a cardiologist, that wrote Health Matters. According to the American Heart Association, women and men symptoms are different. Men, on one hand, their symptoms are more based towards chest pains and discomfort, while women, they still have that same symptom, but before they even get to that symptom, because it's usually a later symptom, they usually have numbness in their arm, pain in their pain in their jaw and their neck. They feel weak and extreme fatigue. They might not experience the chest pains like men immediately. This usually comes later after the other symptoms. In Health Matters, written by Dr. Siddiqui, she explains that the misdiagnosis of women that have heart attacks is due to them reporting that these other symptoms, rather than saying their chest hurt, which is probably not what's going on. So this kind of leads to 50% of the women being underdiagnosed, and which leads to delayed care and probably death. Women of color face other biases when faced with heart attacks or whatever. One thing is that according to the National Heart, Lung, and Blood Institute, African Americans, Latinas, Hispanics, women often face disparities in the healthcare access and healthcare quality, which can affect the heart disease outcomes. Like, they live in neighborhoods with little access to health care or healthy foods. They have poor quality housing. They have few gyms or community centers or walking paths so they can exercise. So this kind of leads to them having more heart issues. Hispanic women and Latina women are 10 times usually face heart disease and heart attacks 10 years earlier than non-Hispanics. And according to the CDC, African American women are 60% more likely to develop high blood pressure, which is a major risk to heart attacks. As you can see, women face many risk factors when they are faced with surviving a heart attack. The bottom line is heart attacks in women go underdiagnosed due to symptoms other than chest pains, like men, and women of color face more issues due to racial bias in healthcare. it is important to spread the awareness and signs of symptoms of heart attacks in women, because no sign should be considered mediocre. Everything needs to be put out, and everyone should be aware that, heart attacks in women may be different than it is in men. Being aware saves lives. Thank you.